Occupational therapy is all about helping people do the things they want and need to do. When a person has a neurological condition, like a stroke or a brain injury, their ability to perform daily tasks can change dramatically. This is where neuro assessment becomes one of our most important skills. Think of these assessments as your compass. They help you understand where your client is starting from after their injury or diagnosis. Without a clear starting point, it is nearly impossible to map out a journey toward recovery and greater independence. These tools provide the essential information we need to create a truly effective and personalized therapy plan. Understanding a client's specific challenges is the first step toward helping them. Neuro assessments allow us to look closely at different areas of function. We can measure physical abilities like dressing, walking. We can evaluate cognitive skills, such as memory problem solving. We can also observe how a person behaves and interacts with their environment. This detailed picture helps us identify the client's strengths, which we can build upon. It also highlights the specific areas where they need the most support. This process is not just about finding problems, it is about discovering potential and creating a roadmap for success. One of the most widely recognized tools in rehabilitation is the Functional Independence Measure, or FIM. You will see this assessment used in many settings, especially in inpatient rehabilitation hospitals. Think of the FIM as a report card for daily activities. It does not measure how a client thinks or feels, but rather what they can actually do. It provides a uniform system of measurement for disability based on the level of assistance a person needs to perform basic life activities. The FIM is designed to track a client's progress from the time they are admitted to a facility until they are discharged, and sometimes even after they go home. The FIM looks at 18 different tasks that are essential for daily living. These tasks are divided into two main categories: motor, cognitive. The motor section includes 13 items like eating, grooming, bathing, dressing, walking. The cognitive section includes 5 items such as comprehension, expression, social interaction, problem-solving, memory. Each of these 18 items is scored on a scale from 1 to 7. A score of 1 means the person needs total assistance, while a score of 7 means they are completely independent. To use the FIM effectively, you must understand its 7-level scoring scale. This scale is the heart of the assessment. Level 7 means complete independence. The person can do the task safely, on their own, and in a reasonable amount of time. Level 6 is modified independence. The person needs an assistive device, a walker, a button hook, but still no help from another person. Levels 1 through 5 all involve some level of help from a therapist. Level 5 is supervision or setup. You might just need to be nearby for safety or lay out their clothes. This level is for cueing or coaxing without any physical touch. Level 4 is minimal assistance. The client does 75% or more of the task on their own. You, the helper, are only doing 25% of the work. Example, help get one arm into the sleeve. Level 3 is moderate assistance. The client does 50 to 74% of the work. Example, guide both arms into sleeves and help pull the shirt over the head. Level 2 is maximal assistance. The client does 25 to 49% of the effort. You are doing most of the work. Lift arms, place in shirt, pull down, help sit up. The client participates but contributes little. While FIM tells us if a person can do a task, the assessment of motor and process skills, or AMPS, tells us how they do it. The AMPS evaluates the quality of a person's performance in activities of daily living. Instead of asking questions or running drills, the therapist observes the client performing 2 or 3 familiar, meaningful tasks they chose: making a cup of tea, getting dressed, tidying up a room. The focus is on real activities in a real context. The AMPS separates motor skills from process skills. Motor skills relate to body movement and interacting with objects. Does the person have the strength to lift a kettle? Do they have the coordination to pour water without spilling? Are they able to maintain their balance while reaching into a cupboard? The AMPS evaluates effort, efficiency, and safety of movements. It helps us understand physical factors making a task difficult after a neurological event. Process skills are the cognitive aspects of task performance. These are the skills we use to organize and adapt our actions. Does the client know what step comes next when making a sandwich? Do they gather all the ingredients before they start? Or do they keep stopping and starting? If they spill something, do they notice and correct it, or do they ignore it? AMPS evaluates initiating sequencing and problem solving during the functional activity. Using the AMPS begins with a collaborative conversation. You sit down with your client and conduct a structured interview. You identify tasks that are meaningful and challenging enough to assess skills. The AMPS manual lists over 100 standardized ADL tasks: making a cold cereal, ironing a shirt. The client chooses at least 2 tasks: make a pot of coffee, organize a small stack of mail. This client-centered approach makes the assessment relevant and engaging. Set up the environment. Make the setting as natural as possible, like the client's own kitchen or office. Ensure tools and supplies are available but slightly disorganized. Give brief, standardized instructions. I would like you to make a cup of coffee just the way you like it. Then you step back and observe, taking detailed notes on your score sheet without interfering unless there's a safety risk. During the observation, you are scoring specific performance skills: motor skill, reaches, motor skill, manipulates, motor skill, lifts, process skill, sequences, for example, puts the filter in before the coffee grounds. Process skill, notices or responds. If she spills grounds, does she clean them up? Each of these small observations adds up to a comprehensive picture of her abilities. After observing both tasks, you score each of the 36 skill items. A score of 4 means competent performance with no issues. A score of 1 indicates markedly deficient performance requiring assistance or creating a safety risk. While FIM and AMPS look at function, the Montreal Cognitive Assessment, or MoCA, is a tool designed specifically to screen for cognitive problems. It's a brief 30-point test taking about 10 to 15 minutes. Think of it as a quick checkup for the brain. It was developed to detect mild cognitive impairment, a decline greater than normal aging but not dementia. In neuro rehab, we use the MoCA to get a quick snapshot after stroke, after brain injury, after other neurological events. The MoCA assesses several domains: short-term memory, recall 5 words; visuospatial, copy a cube; visuospatial, draw a clock; executive, connect alternating numbers and letters; executive, list words starting with F; also evaluates attention; also evaluates concentration; also evaluates language; also evaluates orientation to time and place; administering, sit in a quiet room with the single-page form, read instructions exactly as written; clock task, draw a clock, put in all the numbers and set the time to 10 past 11. Word recall, read 5 words, immediate repeat, then recall after about 5 minutes. Score each item per the guide. Calculate total out of 30. 26 and above is generally normal. Unlike the other tools we have discussed, the Rancho Los Amigos Levels of Cognitive Functioning Scale, or RLCFS, is not a test you administer. It's a descriptive scale used to classify a person's cognitive and behavioral state after a traumatic brain injury. It's a way of observing and categorizing behavior to understand where the person is in their recovery process. Think of it as a map that describes the typical stages a person goes through as their brain begins to heal. The scale consists of 10 levels. Level 1, no response. Level 2, generalized response, perhaps groaning or moving a limb. Level 3, localized response, turning their head toward a sound or trying to pull out a tube. As therapists, our role at these stages is to provide controlled sensory stimulation and watch for any signs of purposeful response. As an occupational therapy student, it's crucial to understand that these assessments are not interchangeable. Each one provides a different piece of the puzzle. Choosing the right tool depends on the client, the setting, the question you are trying to answer. The FIM is your go-to tool in an inpatient rehabilitation setting. Its primary goal is to measure the burden of care, track functional change from admission to discharge. The AMPS is used when you need a nuanced understanding of why a client is struggling with a task. The MoCA serves a completely different purpose. It's a cognitive screening tool, not a functional assessment. The Rancho Los Amigos scale is a behavioral observation guide for TBI clients, not a test. Each tool has its place, and a skilled therapist knows how to select the right one to best serve their client's needs. In the world of occupational therapy, assessment is not simply about gathering data or filling out forms. It's really the art and science of understanding. The tools we have explored, FIM, AMPS, MoCA, Rancho scale, more than just measures. They're your lenses for viewing the complex and unique experience of each client. They allow you to move beyond a diagnosis and see the person, their capabilities, their struggles, their environment, and their goals. Mastering these assessments is a critical step in your development from a student into a competent and compassionate clinician. They provide the evidence and insight you need to advocate for your clients and to design interventions that truly make a difference. Remember that an assessment is only as good as the therapist using it. It's vital to practice administering these tools to understand their scoring criteria deeply and to know their limitations. Always remember to build rapport with your client before beginning any assessment. Explain what you are doing and why it is important. Observation is key. Pay attention not only to the score, the way the client approaches the task, their frustration levels, and the strategies they try to use. These qualitative observations are often just as valuable as the final numerical score, providing richness and context to your clinical reasoning.